If you've ever had a pet before, I'm sure you know how quickly they become an important part of your family. At the Banfield Pet Hospital where I currently work, many of our clients refer to their pets as furry family members or their best friends. If your pet is sick, I'm sure you know to take them to a licensed veterinary professional. However, did you also know that this veterinarian will probably suggest preventive care measures for your pet? Many people don't realize how similar pet and human health care is, and how taking care of your pet often mirrors taking care of yourself. If you were to take your pet to a veterinarian for a checkup, this doctor would probably go over the 3 main parts of preventive care with you: vaccinations, good nutrition, and common surgical procedures. Today, I will act as a veterinarian to inform you on these sections of pet health care. Vaccinations of pets are very similar to vaccinations in humans, since they both protect against communicable diseases and include a killed or extremely weakened form of the virus. Banfield Pet Hospital's Vaccine Handbook is a great resource for vaccine schedules, such as this one for puppies. This handbook suggests that all kittens should receive the feline leukemia vaccination, as well as the FVRCP or feline distemper vaccine, which also protects against calicivirus and panleukopenia. Some of the most important vaccinations for canines include DAPP, which includes distemper, adenovirus, parvovirus, and parainfluenza protection, as well as a vaccination for leptospirosis. Many dogs also get a Bordetella vaccine, which protects against kennel cough, which is a highly communicable disease spread when infected pets are in close contact to each other. Many owners also decide to get Lyme disease for their active dogs, since Lyme disease is spread by ticks in the environment. Rabies vaccinations are probably the most important vaccinations for both cats and dogs, and they are required before your pet is able to be groomed, boarded, or registered in our county. Pet nutrition is just as important as human nutrition, and unfortunately there are a large amount of overweight pets. According to the Association for Pet Obesity Prevention, which was accessed on April 10th, 2015, in the United States in 2012, 52.5% of dogs and 58.3% of cats were overweight. This is an example of a chart that your veterinarian may use to diagnose your pet as underweight, normal weight, or overweight. Since this is such a huge issue, the ASPCA website, which was accessed on April 10th, 2015, suggests a diet change for your overweight pet, which typically includes feeding them less human food and treats, and also possibly using a lower calorie diet, as well as providing your pet with more opportunities for exercise. Special diets are offered in almost all brands of pet food and often include special foods for juvenile, adult, and senior pets, as well as those animals with sensitive stomachs or those that are overweight. Prescription diets are also available in the Hills and Royal Canin brands by veterinarian prescriptions, and they're often used to treat chronic illnesses such as renal disease or help overweight pets. There are a few surgeries and anesthetic procedures that are very common in the veterinary medicine practice. One of these is the spay or neuter procedure, which typically occurs before your pet is 6 months of age or before your female pet has her first heat cycle. According to the Humane Society's Pets by the Numbers article, which was accessed April 10th, 2015, in 2012 in the United States, 83% of dogs and 91% of cats were spayed or neutered. There are a large number of benefits to this type of surgery, and according to the Humane Society's website, which was accessed April 10th, 2015, spayed and neutered pets live longer, healthier lives, and often have less behavioral issues since there is less hormonal issues. Regular dental cleanings are also important to your pet's care, since they can prevent periodontal and gum disease, which may look like this in your pet and be very painful to them. According to Banfield Pet Hospital's website, accessed on April 10, 2015, 91% of dogs and 85% of cats over 3 years of age were diagnosed with dental disease. This means that this type of dental cleaning, which is more intensive than human dental cleaning, is very important, even though your pet may go under anesthesia for it. While the preventive care measures of vaccinations, good nutrition, and common surgeries that you are informed of today may not help your pet in every emergency or illness, they have a large number of benefits to them and will most likely improve your pet's quality of life.